Would you put metal in your mouth if you know it could chip off your teeth, damage your gum, and even increase the risk of infection? A lot of people love oral piercing because it helps them look stylish and it also helps them express themselves. But what they don't realize is the effect this could have on their teeth and their gum. Hi, my name is Favor. I'm a dental therapist. If you're new here, welcome. In this channel, we help you understand your oral health and help you make better decisions for your smile. And if you're already part of us, welcome back. So today we'll be talking about oral piercing, the good, the bad, and the dental risks many people don't know about. So if you have tongue piercing, lip piercing, or you're thinking about getting one, just keep watching because this video could save your smile. First things first, what exactly are oral piercings? Oral piercings are basically piercings placed around your mouth. It could be your lip, tongue, cheek, frenulum, just anywhere around your oral cavity. People get piercings for different reasons. For some, it's a form of self-expression, and some people just simply like the way it looks on them. And for others, it's connected to their culture and identity. And honestly, there's nothing wrong with wanting to express yourself. But before getting any oral piercing, it's important to understand the possible effects on your oral health. Let's start with one of the most common problems associated with oral piercing, which is gum recession. Your gums are soft and delicate tissues. Now imagine having a small metal ring constantly rubbing against your gum every single day when you're talking, eating, laughing, or even while you're sleeping. Over time, that repeated friction can slowly wear away your gum tissue. Then the gum begins to pull away from the teeth, exposing the roots underneath. And the unfortunate part is, once the gum tissue recedes, it usually does not go back naturally, and it can lead to tooth sensitivity, higher risk of tooth decay, and it changes the appearance of your smile. Number 2, it can damage your teeth. A lot of people tend to play with their piercings, especially tongue piercings. So imagine this metal constantly hitting your teeth every day. It can eventually cause your enamel to have a crack or even chip off part of your tooth. And if you have fillings, veneers, or crown, it can damage them, and then you have to spend a lot of money to fix them. The third risk is infection. The mouth naturally contains different types of bacteria, and when you get a piercing, a wound is created, and whenever there is an open wound, bacteria have an opportunity to enter. And if proper hygiene is not maintained, the area can become infected. Some warning signs are excessive swelling, persistent pain, redness, fever, and sometimes pus discharge. And in severe cases, infection can spread beyond the mouth and become very dangerous. Number 4 is swelling and speech problems. Swelling after oral piercing is normal, but for some people, swelling becomes significant. And imagine trying to talk when your tongue is swollen and sore. To pronounce some words become very difficult, and you can also experience difficulty trying to eat or swallow. It can really be uncomfortable. In rare situations, severe swelling may affect breathing and requires urgent medical attention. Thankfully, it doesn't happen often, but it's one of the reasons oral piercing shouldn't be taken lightly. Another thing people don't pay attention to is the material used for the jewelry. Not everybody reacts the same way to metal. Some people might experience burning sensation, swelling, irritation, and constant discomfort. This is why the quality of the jewelry matters. Cheap jewelries can contain materials that irritate the tissue or trigger allergic reactions. So if you're considering getting an oral piercing, it's important to ask about the material used for the jewelry and choose high quality options whenever necessary. I know some people might be asking, does it mean oral piercings are automatically bad? Not necessarily. Many people have oral piercings and never experience major complications, but the risks are real. The key thing is understanding this risk and doing everything possible to reduce them. And if you still choose to get an oral piercing, make sure to go to a reputable professional. Follow all aftercare instructions carefully. Avoid playing with your jewelry. Keep the area clean. Always maintain an excellent oral hygiene, and always visit the dental clinic for your routine checkup. And if you notice anything like pain, bleeding, swelling, damage on your teeth, anything at all, make sure not to ignore it and visit the dental clinic. Oral piercings may look fashionable and help people express themselves, but they can have serious consequences on your teeth and gum. The good news is, being informed helps you make better decisions. If you already have oral piercings, taking care of your oral health and regular dental visits makes a huge difference. And if you're planning on getting one, make sure you understand both the benefits and the risk before making your decision. So if you found this video helpful, make sure to like, share, subscribe, turn on notifications so you don't miss any of our videos, and drop your questions in the comment sections below. Until next time, take care of your oral health, keep smiling, and don't forget to share your smile with the world.